Hi, I'm Phil Noble, President of the South Carolina New Democrats, and I want to talk to you today about something that's important for our state. No, it's really, really important for our state. I'm talking about Medicaid expansion, or Obamacare, if you will. If you listen to some politicians, they make Obamacare out to be like some big spooky ghost sent down here from Washington that's going to haunt us for the rest of our lives. Well, it just ain't so. I want to talk about 3 facts. You know, facts, those funny little things that happen to be true even if the politicians won't admit it. Fact number 1, we really need Medicaid expansion in South Carolina. There's somewhere between 300,000 and 500,000 of our friends and neighbors who don't have health insurance. These are people who are at the bottom of the economic ladder, have their hand on the lowest rung, trying to climb to the middle class. These are folks who work 2, 3, 4 minimum wage jobs to try to take care of themselves and their families, but they just don't have the income to both pay their monthly bills and to provide health insurance. That's what this is all about. And to deny them expansion of Medicare is like an economic kick in the face. It will kick them right off that ladder to economic success and make it so tough for them to climb that ladder to the middle class and lead the kind of lives that they and we want them to have. Fact number 2. Whether or not we accept or reject Medicaid expansion is not going to increase our taxes from the federal government by 1 penny. Either way, it won't make a bit of difference. Obamacare is passed into law. It's been signed by the president. It's been upheld by the courts. And funding for Obamacare, or Medicaid expansion, it's already in the budget. And whether or not we accept it doesn't make a bit of difference in terms of our taxes. It's like more roads or bridges or buying tanks for the Army. It's already there. It's already paid for. The question is, does the money come to us for Medicaid expansion, or does it go to some other state? That's the basic question. Fact number 3. Medicaid expansion is an $11 billion investment into the economy of our state. $11 billion is a whole lot of money. Let me give you some perspective on that. When BMW came to South Carolina, the upstate, they made a huge investment in infrastructure. The same when Boeing came to Charleston, the Low Country. And combined, they invested about $1 billion. Now that's $1 billion as opposed to Medicaid expansion being $11 billion. And it's just like any other kind of economic investment by a company or business in this state. It creates jobs, economic opportunity, it hires nurses and hospital workers and construction workers. It's a boost to the economy of this state, and we desperately need that. So those are the 3 basic facts, folks. And what it boils down to is a very simple choice. Whether or not we're going to accept the Medicaid expansion or we're not. It's not going to increase our taxes from the federal government by 1 penny. We desperately need those jobs in this state, and there are almost 500,000 people in this state, our friends and neighbors, who desperately need that health insurance. So that's it. That's the choice we have to make here in South Carolina. I hope we make the right choice.